Let's turn for a moment to a late onset LH unaffected. Let's talk about a male over 25, 11778 mutation. Is there anything different about those patients systematically than the more typical?
Race to speak first.
Please, my good friend can go first.
So, we started from a completely anecdotal observation with this family in Brazil. And then we reanalyzed all the data that we had from the Italian patients, and actually they probably fit with the UK group of patients as well. The impression is, obviously, it's not always black and white. So if you subdivide patients by being exposed to some environmental factors triggering the disease, and let's say, just for simplicity, just consider tobacco. So if you subdivide patients between those who smoke tobacco and those who did not smoke tobacco at the time they got affected, so they lost vision, then you have two very precise subpopulations. So people not being exposed to the environmental trigger usually have an early onset disease and quite severe. Let's say this would be the classical case at 15 to 20 years of age with the profound loss of vision and so on. Then you have this subgroup of patients that are exposed to tobacco. The average age of onset is actually shifted quite a lot. So in this group of patients, you would have an age of onset which is over 30. And a subgroup of the subgroup is actually over 40. So over 40 years of age onset seems to be people that were exposed for decades to tobacco smoking. If they were not exposed, they probably would stay carriers, not being affected. So I start seeing in our data a sort of division between purely genetic cases and the purely environmental cases. And the purely environmental cases are sort of different in clinical expression characteristics and so on. He has some experience because they ran a specific study on all cases.
Yeah, we discussed that, Valerio, quite a lot, and it makes sense that you have your classical disease where the genetic factor predominate, but as you grow older, then the environmental factors become more prominent. The caveat I would say to that, and I see René Decoux here sitting in the audience, we did this big study, as you know, involving the UK families, German families, and the Dutch families, looking at risk factors from which the smoking story came out. But the paper was published last year, but we also looked at a subgroup of patients, about 20 or so, with visual loss greater than the age of 50, so late onset. And when you did the statistical analysis, right, there was no real obvious distinguishing factor between the smokers and non-smokers. So I think there is good, certainly your data is very convincing, but I must say that when we looked at our subgroup of late onset in these 3 geographical areas, that story did not emerge.
Yeah, I know because I did review that paper.
We've discussed this so many times that we tend to get maybe a little bit into the weeds here. I just want to bring it back so everybody understands what we're talking about. Essentially, that labors can be on a hair trigger, and that tends to happen usually in the teenage boy. And it's just so set to go that it doesn't need anything to push it over. Or it can be in a situation where it has a chance that the patient will never lose vision, but if you accumulate enough stresses, enough triggers, it'll happen anyway. So the first group we can call the typical group, and the second one, for the purposes of this discussion, we can call it atypical. But unfortunately, the vision loss can be just as bad on the one that's not on a hair trigger. But it's all the more incumbent of us to try to avoid those risk factors and to perhaps mitigate them with things like idibinone, because there are some patients for whom it's not fated to lose vision.
And I think what has become so clear, isn't it, compared to what we were discussing 10 years ago, is the role of environmental factors in how we, and it's really relevant in terms of what we're going to discuss later on this afternoon about understanding about the genetics. We've been so obsessed by genetics for a long time that this has actually muddied the water in terms of the analysis, and now we need to take these into consideration.
Yeah.